of the unique programs that Loma Linda University operates, in fact they initiated it for the world, was the Implant Dentistry program, which started under the auspices of Dr. Robert James, a dentist who had practiced in Bermuda and had maintained a long interest in implant dentistry. In fact, he was a faculty member when I was a dental student, and I had the opportunity to work with Dr. James and actually treat a couple of patients with implants under his guidance.
My father knew implants worked, but there was a natural curiosity to his personality, and I don't think just placing implants was going to be enough for him. He had learned to place implants through Dr. Norman Crane, and he'd met him in the early 60s at a lecture that Norman had put on in Brooklyn, and was really excited by implants, and they got to be very good friends. Norman mentored him through the 60s, and when Dad got the opportunity to go to Loma Linda and teach, he got a position as an associate professor. He just jumped at the opportunity.
If we are going to have a soft tissue supported prosthesis, we're going to want an entirely different arrangement of our implants than if we're going to have a fixed appliance. Let's illustrate the mandible like so, and let's say this is our neurovascular bundle. Let's make this a soft tissue supported overdenture. Now, what's one of our basic principles for the prosthetic reconstruction with a removable partial denture? The fulcrum must be located as far forward as possible. That means then that if we're going to be soft tissue supported, we want our fulcrum well forward. In order to have a fulcrum well forward, we're going to want our anterior two implants spread a reasonable distance apart. And I like to have a minimum of 10 millimeters between my two anterior implants.
Within 2 years of being at Loma Linda, he went after his master's of pathology, and this was just bonus for him because it gave him access to the electron microscope at the university. So he could now look at why these implants were working, what was the tissue interface. Most of the early studies were done with animals. However, there was a point at which one of his patients died and left his jawbone to my father. And as macabre as that might be, it was a huge gift to the field of dental implantology. I remember when Dad presented these slides, these histological slides, at the International Congress in Sydney. The energy in the room was just amazing. People came up to my father afterwards, and there was so much excitement, and it was because it was the first time we'd really looked at cellular growth interface with implants. And this lecture really kind of put him on the international stage, which could only benefit Loma Linda and their Loma Linda program because it gave Loma Linda a recognized face.
What Dr. Robert James wanted to do is to make sure that an individual, if he's going to be doing implant dentistry, that he could be doing it with a scientific background by taking courses in university level, practicing with patients under supervision, and then eventually providing that service to patients.
Okay, our family tree starts with Dr. James's study club, which was filled with dentists, practicing dentists from the community, of which one was Rob Capone, who persisted at working on Bob until Bob agreed to take him as a graduate student, and Dr. Capone became the first person to try to finish a program in oral implantology at Loma Linda. I followed him, and I was followed by Philip Lindley and Alan Altman, and subsequently by Jaime Lozada, Dr. Lozada, who needs no introduction.
The physical location of the implant dentistry program in 1975, when originally started, was in the faculty dental office off of Taylor Street, just next to the dental school parking lot. And in fact, that's when I came here for the first time to interview as a student. I remember faculty dental office very well. It was my first experience practicing here in the United States. It was essentially a large dental office, 12 dental chairs that were available there, but the implant dentistry program at that time had 2 or 3 chairs allocated to the program. And from those 3 chairs, one room was our surgical suite. It was just a little bit larger room than your regular dental cubicle. But the procedures, right from day one, were conducted in a sterile environment. That's one of the things that impressed me the most right from the beginning. To see that in a regular dental office, we were able to use sterile packages, disposable gowns, prepare the patient quite adequately with betadine that we used to put in their mouths as well to scrub all the bacteria off and outside the patient's face as well. So it was something that I was not used to at all. So even though for today's standards it's perhaps not ideal, back then it was the perfect environment to be educated in implant dentistry.
The facilities, well, for those of you who is current residents or recent residents, I mean, your life is actually very good. I hate to tell you. I remember when I first started, I started at the faculty dental building. And if you don't know, it's at the corner of Taylor Street, right besides the power plant. Little tiny building, and it is not the whole building is implant, it's only just a tiny little area. And nothing fancy. We don't really have a true operating room, nothing fancy, just a couple of dental chairs, and just we work there. No space, and we're just, like working in very limited areas. Then I was blessed enough that during my residency, I witnessed the migration of the implant program from the faculty dental building all the way to the school, Prince Hall, the dental school. And that was amazing, absolutely amazing. State-of-the-art surgery room, okay? The treatment room is kind of small, but it's better than nothing. So all I can say is the implant program from a physical facility standpoint really transformed from a little tiny area to a really world-class area there.
When I came into the program in 1992, there was one director, and that was Robert James, and then there was his co-director or assistant director. In fact, I believe that when I started in 1992, Dr. Lozada was just part of the staff. I don't remember if he was actually the clinic co-director in 92. I do know that within my residency, he might have evolved into that position, or he might have had it before I came in. I just don't remember it. But those were really the 2 main individuals at the time that were directing the program and were directly part of our education day to day. Now, we had a lot of part-time faculty that were coming in, individuals like Dr. Daher, I remember, Dr. Peter Worley, but Dr. Bob James and Dr. Lozada were certainly the biggest contributors. Now, in the middle of my residency, in my second year, going into my third year, Dr. James actually passed away. And I'm real proud of my director and my good friend Jaime Lozada for standing tall and doing the right things and keeping the program going during that very tumultuous time.